Today I'm going to demonstrate how to section a trach. So the first thing you need to do is gather your supplies. Supplies you need are gloves, some normal saline. I'm going to pretend this is saline. We need our section catheter, a towel, and our stethoscope. So once we have our supplies ready, we will go to the patient's room. We're going to wash our hands. We're going to knock on the door. Hi, this is Linda, your nurse. I am just coming in to check on you and see how you're doing. Can you please verify your first and last name and date of birth for me? And I would check the armband and the medical record and make sure it matches. And I see that it matches. So I'm going to provide for privacy. I'm going to close the door to the room or pull the curtains if needed. And then we'll explain the procedure. So Mrs. Harper, I am thinking your trach probably needs to be sectioned. So we're just gonna take a section catheter and section that out for you. So next I want to get my patient in position. So I'm going to elevate the bed a little bit so it's a good working height. I'm going to put the patient in Fowler's position. This is as close to Fowler's as this one goes. So Fowler's position. And then I'm going to make sure the side rail is down on my side of the bed. Make sure it's up on the opposite side of the bed. And then I'm going to go ahead and put some gloves on. So I'm going to wash my hands first. And we'll get our gloves. All right, so then I'm going to do an assessment. I'm gonna assess her respirations for depth and rate. I'm gonna look for signs of dyspnea. I'm gonna look at her color, make sure she's not cyanotic. We'll check her oxygen on the pulse oximeter, make sure her oxygen saturation is good, check for signs of hypoxia or hypercapnia, which would be an elevated blood pressure, heart rate, respiratory rate, anxiety. She might have some decreased level of consciousness. And then we're going to listen to her lungs, auscultate. We're going to listen underneath the gown so we get the best lung sounds. Okay, Mrs. Harper, you sound like you need to be suctioned. So we're going to go ahead and check our equipment. We're going to make sure that our suction tubing is connected to the canister. We're going to make sure that our suction is turned onto continuous between 120 and 150. And then we're going to want to hyperoxygenate, so we're going to turn up her oxygen as well. And then we're going to place a towel across her chest. Okay. So now we're ready to open our section kit. So we're going to go ahead and take off these gloves, discard those, and wash our hands again. We are going to get everything ready. So we're going to want to adjust our table. I prefer to put it kind of back towards the patient and overlapping the bed slightly. And the reason for that is so that I can put my water or saline right here on the table. And then when I turn towards the patient, it's going to be to the side of me instead of behind my back. So make sure your table is over far enough that you're not going to be turning your back to your sterile field. All right, so we're going to start by opening up our sterile saline. So we're going to twist that cap off and we're going to place it on the table upside down so that we don't contaminate it. And then we're going to push it back out of the way. All right. Then we're going to open up our kit. And we're going to do that kind of slowly and carefully here because sometimes the content can get jarred around in there. And you want to make sure you don't touch the inside of this cover and you don't want to touch past that glued edge. And you don't want the supplies inside to touch past there either. If your supplies do shuffle around and touch, make sure you let the instructor know or go get a new kit because you want everything to be sterile. Oops. Okay, so we've got that open. So next we're going to grab the box out of there. And I always grab it by this plastic because I don't want to risk touching anything else in there. Okay, you want to make sure you don't touch this top plastic edge because that needs to stay sterile. So then we're going to squeeze the box so it opens up. And we're going to set that on our table here. Okay, if we're going to use the gloves inside, then we're going to shut our sterile kit again. If we are going to use a separate pair of gloves, then we want to leave it open and I just push it back to the back of the table. So, all right, so we've got our box right there. So now we want to reach our sterile saline. And we're going to pour a little in. Make sure you hold it up high enough, like 2 to 4 inches, so that the rim doesn't hit the box. That will contaminate it. And you want to make sure all your items are out of your way so you're not going to be crossing your arm over your sterile field. So then we're going to put this cap back on. Okay, and we can move our saline out of the way. Okay. So now we want to get our gloves on. I'm going to, for the sake of using the front of this table, I'm going to push this to the back, making sure I don't touch that upper part. Okay, and I'm going to pull this forward. So I'm going to try these gloves here and see what I can do. Sometimes they're tricky, and so I always bring an extra pair just in case. So we're going to flip this over. Okay, being careful that we don't let everything slide around because if it hits the edges, it's contaminated. So we're going to open this up, make sure it's good and open so it's going to stay. And we will pick up our first glove by the cuff and hopefully they're going to come apart. These ones are coming apart so far. If I needed to, you could slide your finger inside the cuff where your hand is going to be, but not anything outside of that. Okay, so we got that. So now we can put this on. And some people, before they open the package, will kind of do that with the package, and that can loosen the gloves up. But be careful because that also loosens everything else in the package so it could slide around. So we're going to pick these up carefully because it's so easy for them to hit the edges. Okay, so slide these gloves on. Okay, and then we can come in for our catheter kit. Okay, we're going to take this out of here. We're going to start by putting the tip in our hand and wrapping it around so that we can hold this securely so we'll be able to plug it into the tubing. So then we can reach our tubing here. And we can plug that in. Making sure that our sterile hand is not going to touch our non-sterile hand. This one's not sterile now that it's touched this tube. Okay, from here, we can just kind of hold this wrapped up just for the sake of keeping control of the tube so it doesn't hit anything. All right, so we are going to let the client know we are ready to begin. So I am going to move the oxygen mask off to the side so I don't have as much chance of hitting it with my hand when I go down. If I had an ambu bag, I'd give a couple breaths before I go down, or I just make sure the oxygen was on high so I'm hyperoxygenating. Okay, I'm gonna let this uncoil so that I can keep control and see where my tube is. I'm gonna keep my thumb ready to go on this section, but it's not gonna go on there until after I get in there. So we're gonna go ahead and put that tube in there. Gonna go about 4 inches. So when I meet resistance or the patient coughs, okay, then I'm gonna pull it back about 1 centimeter. Watch for any signs of respiratory distress. And I'm gonna start tapping my thumb on here while I twist coming out. Okay, and I don't wanna take any more than 10 seconds sectioning. All right, so once I pull that out, I'm gonna kind of coil this up again so that I have control of where my tubing is. We will set the mask back on there with our contaminated hand. Okay, we're going to dip this in the section, use continuous suction to suck some through. We're trying to clean all that gunk that we just got out of our tube, so we're just gonna suction some through. And while we're waiting for a minute to suction again, we're going to reassess. So we're gonna look at her color, make sure her color is good, look for signs of dyspnea, look at her pulse oximeter, make sure her oxygen's doing okay. So just a quick visual assessment. Okay, and it looks like you may need another pass with the suction. So I'm gonna keep control of my tubing here. We're gonna move this over. Again, if I had the ambu bag, I would go ahead and give two breaths. Okay, I like to hold this up high so I don't contaminate. So we're gonna go down, put it in about 4 inches. Make sure we're not touching the trach with our thumb. We're going to on and off here while we rotate and come out. Okay, we'll hold this. We'll put that oxygen back on. Okay, and then we're going to do continuous, keep our thumb on the section to clear this through the line. All right, Mrs. Harper, are you feeling any better? You're sounding better, you're looking better. So you're always gonna reassess while you're waiting that 1 minute in between. And she looks like she's doing a lot better. So we're gonna go ahead and call it good for the sectioning. So we're gonna go ahead and disconnect our tubing. Okay. And then we can go ahead and throw this away. We can take the towel off her chest. Okay. We can reposition her for comfort. Usually not going to be supine, usually upright. We'll make sure we put the side rail back up, bed in the low position. When her oxygen's doing great, we'll go ahead and turn the oxygen back down to her normal level. And then Yeah, we'll discard our supplies. Mrs. Harper, is there anything else I can do for you today? If not, here is your call light. Call me if you need anything before I come back to check on you. We'll take our gloves off. We'll wash our hands. And then either before we leave the room or after we leave the room, we're gonna go ahead and chart. We are gonna chart the color of the secretions, the amount of the secretions, consistency of the secretions, odor of the secretions, and how the patient tolerated the procedure.